Welcome to the Men's Health Unscripted podcast with Patrick and Cam.
Where we focus on your entire health, mental, physical, spiritual, and emotional to make sure you are good to go every day.
Welcome to the Men's Health Unscripted podcast with Patrick and Cam. And today our guest is Dr. Michael Werner, founder of Maze Men's Health. He's a board-certified urologist, and he specializes his practice around male infertility and sexual dysfunction. So, Dr. Werner, I'm so excited to have you on the show today. We got a lot to cover. How you doing?
Good. Thanks for having me. It is a lot of ground to cover, so maybe we'll pick a couple topics and expand those in a meaningful way.
For sure. So, in doing my research for this podcast, I kind of, we're followers of Maze Men's Health on Instagram, and I saw that you've been practicing for 28 years.
Yeah, it's actually up to 30 now. We
Okay.
have to update it. So I started the month that my son was born in June of 94. So July, and so we started in July of 94. Maze actually stands for Matthew, Adam, Zach, and Evan, which are our four sons. So.
Oh, nice. That's awesome. So I kind of wanted to ask, in your time in 30 years of practicing urology and focusing on men's health, how have you seen the dynamic of how men take care of themselves change? I know Cam and I have been at this for about 4 years, and in that short time, we've seen how men have kind of started more exploring their mental health and emotional health. And really, when we first started it way back in pharmacy school, so our total work in men's health has probably been about 6 years, where guys really didn't want to address their health. How have you seen how that's changed in your experience?
So there's been two main changes or areas where men have become very interested in pursuing their health. The first was when Viagra came out, which was actually on my birthday. I'm sorry, our anniversary. So March 29th, 1998. And the second was the availability of FDA approved testosterone. So both of those touched men in ways that they actually value sometimes. So Viagra came out in 1998. Before that, we were treating men with erection issues, and mostly we were using injections. But first of all, that was pre-internet and it was pre-Viagra. So first of all, no one knew that there were specialists who were treating. No one knew that anyone else in the world had erection issues. So it was hugely embarrassing, mortifying. And people really spent their whole lives who had had ED sort of working around it. I had a patient who'd never had good erections, just married a woman who had no interest in sex. Like was just so many things. And so that sort of blew up the fact that men have erection issues and we actually have a potential treatment for it. So men became very aware of that. And most people say that the only thing that brings men into the health system is their sexual health, meaning their, in this case, their erections, and then also when it comes to testosterone, their muscles, their libido, and their energy. So then testosterone, some FDA-approved testosterones came down the pike, and that really revolutionized the interest in testosterone replacement therapy. And then, of course, the internet meant that you didn't feel alone and you had access to really potentially good information. So those were the two revolutions that I've seen, and that sort of then sparked. Again, this is just a hypothesis that just sort of sparked the interest in men's health. I do find that, as you noticed, men are pretty not interested in their general health, and many of them do not take good care of themselves. So they don't monitor their blood pressures or cholesterols or weights or sugars, which of course are super, super important. I can get them to sort of do what I want because it is linked in with their erection issues. And so if you see your erections as a barometer of your overall vascular health, then you're more motivated to take care of yourself.
Certainly, I can agree with that. We kind of noticed that monitoring lipids, weight, sugar, all that, you can kind of dangle the sexual health carrot in front of guys. And so we offer a free smoothie download. It's called Daddy Juice. It's got celery, beets, and watermelon in it. Just some foods with, nitric oxide, generally healthy foods. You can make a smoothie, add whatever you want to it. Just kind of, that's like the base. And when I was telling guys, hey, these nitric oxide rich foods, like it'll help lower your blood pressure, you'll have sustained energy throughout the day. There's some good nutrients in there. They just kind of were like, I don't care. Like, that's dumb. But when I said, well, that nitric oxide could also potentially improve your erections, and the zincs, in the foods can also help with sexual health and stuff like that for a more holistic way, their eyes perk up.
Yeah.
So
Well, I
if
find
you,
that, yeah, no, I find a lot of the men have been told by their doctors that they need to be on a cholesterol medicine, which is really the lowest hanging fruit. And I don't want to be on a medicine, and I've heard that it gives you muscle aches, and then they walk in and they're having erection issues, and we look at the blood flow through their penis and it's diminished. And I sort of say the data shows that if you're having erection issues in your 40s, you have about a 10 times higher chance of the average man of having a heart attack in the next 10 years. And so when I let them know that those two are related and it's going to help slow down the progression of their erection issues, and that also that'll be sort of, if they walk in here with that, a heart attack or stroke doesn't necessarily kill them. They could be a cardiac cripple or walk in here limping, and slurring their words. Then I'm not gentle about getting men to take care of themselves, but relating it back to sexual health can be very useful.
for sure, you shouldn't be gentle either, just because it's so important. And I think guys don't really think, they don't necessarily always take those things into account. Um,
So one of
so
the things with erection issues that I think is really important is a lot of the men will try the oral medications and they don't work for them. And so there's two pieces to that. One is that they have to make sure that they should always start with the maximum dosage. And then of course they have to take them correctly. You would know as a pharmacist. So the Cialis, which is tadalafil and it's generic, kicks in at 2 to 4 hours, and half of it's gone at 18 hours. So it's a great date drug, if you're
yeah,
planning something. It could be
weekend
with your,
drug.
yeah. Though, again, half of it's gone at 18 hours. So you're not going to necessarily, if you and all of it's gone by 36. So at 24 hours, there's going to be a lot less than there was at 4 hours, So I'll often have just guys take another one. And then the Viagra, of course, which was the first on the block, sildenafil, that doesn't work if you take it with food. So a lot of men will come in, they're on a low dose of the sildenafil, the Viagra, and they're taking it with food, and they're wondering why it's not working. And then, of course, it may not, for even max dose and taken correctly, that may not be powerful enough. And that's when we use usually the injections or vacuum erection device.
Interesting. That's pretty informative. So I kind of wanted to talk about male infertility as well. This is
Okay.
something that we haven't really covered too much on the podcast. And we've definitely covered testosterone replacement therapy. I think most of our audience when we first started was like, tell us about T, we want to know.
Yeah.
But as we went, we found out that certain testosterone replacement therapies kind of lower your fertility rate.
Yeah,
So
so anytime you take testosterone from the outside or exogenous testosterone, what you are doing is you simultaneously sort of shut down, for the most part, your own production, your endogenous production of testosterone, which is fine because if you get a good level of testosterone, you have a good level of testosterone, except that it does affect fertility. Because in order to make sperm, you need a very high concentration of testosterone in the testes. And the only way to get that is if you're actually making it there. So that's why it's sort of the worst of both worlds, because you can't use testosterone as a contraceptive because it doesn't shut everyone down, just most men. So you can actually get a partner pregnant on testosterone, but but it shuts down many men and decreases most men dramatically. So if you are trying to get a partner pregnant, then that's problematic. So what we do in those situations, if you're actively trying to conceive, is we give you something. We have a couple of options, drugs that make you make more testosterone, which then stimulates you obviously to have more testosterone, but actually can even help with sperm production.
interesting.
Those two drugs are, well, there's two different classes. So one are called It doesn't matter what they're called. They're called SERMs, selective estrogen receptor modulators. So it's either Clomid or clomiphene citrate. There's only right now there's not a generic, it's only the branded. And off-label, you can use the more male part. Clomid is like a pair of gloves. It has a right hand and left hand molecule. If you separate out one of the molecules, it's more androgenic, and that's called clomiphene citrate. That you can get from compounding pharmacies, and we use that. The other option you have is an injection 2 to 3 times a week called HCG, which basically mimics LH, which is the hormone we make to stimulate testosterone, our testes to make testosterone. And sometimes we give both.
So would you find that those seem to be more of a reliable source for guys to still be able to impact their testosterone and get back to a youthful level or an appropriate level while still maintaining their fertility?
Yeah, so it's a very interesting question. What happens is we can almost always get the men to have good levels unless they have true testicular failure of testosterone, but they don't feel as good as on the testosterone, even when they get the same levels. It's almost across the board. There's different theories as to that, which we don't have to go into. So I've sort of changed my practice in the last 3 or 4 years. There's also been more and more reports about there's more and more abnormalities in the children of men who are older, as opposed to younger men. And that sort of makes sense because if you think about how many times your sperm are splitting and then splitting and then splitting, and then each time there's a chance of mutations happening. So there's a lot more mutations in the sperm of a 20-year-old man than a 40-year-old man, and a 40-year-old and a 60-year-old man than a 40-year-old man. So when you add that and the fact that men are getting married later, if they're not actively trying to conceive, or sometimes they don't even have a partner, and they're really being negatively impacted by their low testosterone and their symptoms of low testosterone. They're not motivated to date. They're not getting good erections. They're having a hard time taking off weight and putting on muscle. They're sluggish. Their mood is not good. Then what I've been doing is banking their sperm. We have the biggest sperm bank in the tri-state area, New York, Connecticut, and New Jersey, and then putting them on testosterone. Now, when you put them on testosterone, they still, if you take them off the testosterone, they'll almost always go back to where they were, but they're going to be miserable during that process because they feel so good on the testosterone. So they're very happy if we have the bank sperm. So I sort of twist their arms on that one too.
Right. And I know that once kind of you get started on the testosterone, it's kind of tough to come off of it. When guys are kind of coming off of it, I've heard some docs, they talk about actually initiating Clomid or HCG to come off so that they don't feel as bad, or like their testosterone doesn't kind of go into the toilet.
Crash. Yeah.
Right.
So we do that. We go down slowly on the testosterone, adding in Clomid or HCG or clomiphene citrate, something that makes them start bumps more quickly. They're starting to make their own testosterone. Nice. They still feel crummy, but because they feel so good on the high, on the testosterone. And I keep men at pretty high levels of testosterone. I'm really treating symptoms, not the numbers. So I sort of go where I need to go to make them feel good. I'm not trying to make everyone Arnold Schwarzenegger, but I want their libidos to be good, their energy to be good. I want them, when they work out, that they actually notice changes.
Sure. Yeah. So are there any infertility issues that kind of come around from not using testosterone? I know there's azoospermia and just different issues. How else do you address these issues if guys are coming in? Because I'm sure it can hamper their quality of life if their partner wants to conceive, they want to conceive, but for whatever reason, they just can't. And let's say, for the sake of the Men's Health podcast, it's the guy's fault, right?
Right.
What issues have you seen there?
So 15, a lot of couples have infertility, and the breakdown is that about but it's about 20% male problem. Let me backtrack. So a lot of couples obviously have infertility. Sometimes it's a combination of problems for the two of them, and sometimes it's mostly a female factor, and sometimes it's a male factor. But a male factor is involved in about 60% of the time, whether with a female factor or not. So our role as specialists in male infertility are to, first of all, establish a baseline. What is their semen analysis? Because they can vary. Two, see, is there anything we can do to make it better? So do they have dilated veins in the scrotum, like a varicocele? Do they have hormonal abnormalities? Um, Three is, depending on how low it is, are there genetic abnormalities that would affect a baby? So we do genetic testing. And then sort of give them advice as to what their next steps would be. So I sort of seem to have a very high, I get a lot of the men with azoospermia, as you mentioned, which are men with no sperm in the ejaculate. And once we've done the evaluation to see if we can make them make sperm, if that has failed, we are actually the only people in the country who do a specialized, really lab test where with men with no sperm in a conventional semen analysis, we spend 6, 8 hours looking through it and taking individual sperm if we find them and putting them onto specialized dishes. And we're finding in men who other semen analyses are showing zeros, we're finding sperm in about 40% of the men, which is pretty remarkable, which saves them a surgery of having to go in and take out sperm combined with an IVF.
Wow.
So it's
So are
pretty,
those sperm coming from the testicular tissue, or
yeah,
where are you finding them?
yeah. So the sperm are made in the testes, as you said, and then they are released into the tubules. And then when a man ejaculates, they're collected and they go into the ejaculate. So when we're doing what's called an extended sperm search and microfreeze, we're looking at the ejaculate. In other words, in the ejaculate, can we find even a few sperm that you're not going to see conventionally? The analogy I give is like if you have a big pond or a lake and there's 7 fish in it and you put a net in, you're not going to find a fish. But if you drain the whole lake and look at the bottom, you'll find those 7 fish, but you have to do it in a way that keeps them alive, of course.
Interesting. That's kind of the first time we've really heard about that or discussed it. That's an interesting way of
Yeah,
looking
it's
at it.
very cool. And we have people coming really from all over the country for it because we can then freeze it and then send it back to where they're coming from. The only way to use it is with an in vitro fertilization, with a partner. They're taking out the eggs and injecting individual sperm in a process called ICSI into the eggs.
So have you seen infertility kind of been impactful on male relationships with their partner? And then kind of in what kind of ways? I know like we like to talk about the physical components of it, but for anybody out there that's listening, you could kind of just let them know they're not alone. I mean, is there anything that you've seen where the relationship is kind of impacted because of
Yeah,
this?
I mean, definitely it impacts the relationship, especially if this is really important to one or both partners, which it usually is. It's very stressful. I love this study came out of India a while ago that for couples that were trying to conceive for more than 6 months, 50% of the men started having erection problems because they were so stressed out about, just trying to ejaculate in the right place at the right time. We actually have, for the men who are having difficulty with ejaculating, I mean, I didn't create this obviously, but it's called self-inseminations. It's basically, to be crude, the turkey baster technique. So they just ejaculate into a cup. It comes out clumpy and goopy, but then at body temperature, they just hold the cup in their hand. It smooths out and liquefies, and then they just take a syringe, no needle, and the wife puts it into her vagina, and you're getting the sperm in the right place, just an alternate method of doing it. And we have, over 300 babies in my practice just from that. These are men who can't ever ejaculate inside a vagina, or men who just the stress of having sex and trying to conceive are sort of throwing them over the edge.
Certainly. I mean, it sounds like it works. Probably a little less fun than the conventional method, but
Yeah, if you have children and you've lost a lot of sleep and a lot of sex and a lot of money and a lot, I'm glad I have children, but they're the worst thing for your sex life and the worst thing economically. You don't think about. It's very rare that when you have a child, there's so many other things that you're thinking about how you conceive them. I would bet if you ask 100 parents, they could pull it back, but it's not one of the memories they keep coming to unless it was on the honeymoon on a beach, and that's just usually not the story.
right. I've had a couple buddies that we were out partying with like them and their wives or whatever. And I know I think they had gotten pregnant shortly after and they were like, remember that night we were out? Yeah, it was the night that it happened.
Right.
So,
But they don't really, 10 years later, they're not gonna like, oh, I remember that night, you know? So
right. All of us remember it, but and like we'll remind them, we're like, hey, we're, partly responsible for that guy.
well, do you help support them and feed the babies at night when you're
That no.
okay.
That's
So you're
that's
not
on
much
them.
responsible, yeah.
Right. Just like kind of from afar, it's great to like, play with the
Come back,
kids. It's awesome.
yeah.
Um, and then just kind of give them back when the
So,
time's up.
so with infertility, yeah, the key is the most important factor I tell couples in this day and age, where we have IVF and IUIs, where we can compensate for poor semen analyses, is does the man have any sperm, and how old is the woman? The most important, couples are waiting longer and longer, and doesn't matter how youthful, for the most part, a woman looks. The age of the eggs is the age of the eggs. Obviously, different women have different curves, and some women, in terms of the quality of their eggs and time. So some women, they're, go into menopause in their 30s, and some women have babies at 44. But there's a very steep decline in egg number and egg quality starting at 35. So I always tell couples, if once you figure out that you're going to have kids together, just have them, because there's no right economic time. It's always a disaster. And, it's not a good economic decision. And if you wait until your jobs are completely settled and you have enough bedrooms in your house or whatever, sometimes your clock has run out. So
So
don't. And also, you're that much older, your kids will have you for that much less time. They'll have the grandparents for that much less time. There's a value in younger rather than older.
for sure. I think being able to keep up with the kids, because I've got family members and stuff like that. They got little ones and they're just running around, and I couldn't imagine doing it when I'm older. I'd be like, oh man, I gotta just getting up. Like it's sleepless.
Yes.
It's tough.
So when are you having your kids?
Oh, probably never. I'm not a big kids guy.
Got it. Okay.
I coached baseball for a long time, so I felt like I kind of had that experience. I just don't think it's for me. I like dogs.
Got it. No, it's good to know, because you do not want to have children if you're not really dedicated to having them, because they do take over your life. And
Right.
I'm one of those people, I can't imagine my life without them. One of the services I think that I do, that I really help men, is some of the men do have no sperm in the ejaculate, and no matter what we do, we can't find them. And then they have to decide what they're going to do. Are they going to live without children? Are they going to use donor sperm, or are they going to adopt? Those are sort of your issues. It used to be, when I opened my practice, so again, that was 30 years ago, there were many areas of the world where, there were babies who were really needing to be adopted. And it was always difficult, but not impossible to adopt. And you really were saving the quality. I mean, we're just making a dramatic change. A girl growing up in an orphanage in China was going to have a very different life, as a child in America in a loving family, hoping to get there. But then, of course, that most of these countries have shut their borders in terms of allowing couples abroad to adopt. So it's very hard to find children to adopt if you're actually looking for an infant, and an infant without obvious disabilities. So I find that a lot of people are sort of against donor sperm at the beginning, and then I really push them hard to think about it seriously. Because if they want children, if someone dropped a perfect child in their lap, most of them would be delighted. And the patients that we've sort of had these discussions back and forth, and they do end up using donor sperm, are just delighted, and they can't imagine their lives without these kids. And it's two people in that relationship. Many of these wives are even more passionate about having children than the men, at least at the beginning, until their children appear. And so I find that that's an option that is, not used as much. We're actually a lab that you can actually, let's say that you can't have sperm, but you have a brother or a cousin, or someone close to you. You can actually have that sperm banked tested for genetic issues as well as sexually transmitted diseases, and then use that. That's called the designated donor. Just a lot of paperwork, but it's very doable. And then, of course, there's anonymous donors. So I would say to the couples, think very clearly before, if you really want children, before you decide, against it completely, if it's something that's really always been part of your picture.
Yeah, that was something I was going to ask about, because we've never really discussed like the donor sperm aspect of fertility. And I was kind of wondering when you were talking about it, is like, I wonder if guys get really apprehensive about that, because it's like, well, it's not yours kind of thing.
Yeah,
I guess that's like the thought process, right? But
right. I think there's different pieces to being a father. One is the biological piece, and one is the acting, as a father. And you talk to many people whose father disappeared or was never part of the picture, and a stepfather came along, and that's their father. And many of them have no interest in their biological father and are passionately connected, in appropriate ways to their father, who is biologically not their father. So, yeah, I think that there's who raises the child and who genetically, and you obviously are giving up that genetic piece, which is a very gratifying piece. But once you become a parent, you see that it's a much smaller piece than you thought, in terms of your gratification from raising a child and your relationship with them.
yeah, that's awesome. I'm glad we brought that up and kind of talked about that a little bit, because I know that, probably there's a lot of guys out there with a bunch of different kind of thought processes on it and issues, and hopefully this gets to answer their questions, or at least can guide them in the right direction. So any other topics in male infertility that you'd like to hit that we haven't addressed yet?
No, we talked about how you ideally would bank sperm, before you go on testosterone replacement therapy. I'm sort of becoming an advocate. Maybe it's self-serving, that if a man reaches about 35 and knows he wants to have children, but is not, hasn't found the right person, it may be worthwhile banking those sperm, because I'd rather have, which stops the genetic mutations from happening. I think I'd rather use the frozen sperm of a 35-year-old man than the fresh of a 45-year-old or 50-year-old man. So I think that's an expanding area in male infertility. I think the other thing that's changed, you asked at the very beginning, is in the field. It used to be, because men were just so not wanting to face that they could be part of an infertility problem. It was always, oh, it's the woman's fault. And they used to do this massive evaluation of the woman, and then finally do a semen analysis on the man and find out, of course, that that might be the issue. And now I find that that's appropriately happening simultaneously, when usually the woman starts the process off by going to her OBGYN and saying that she's having a hard time conceiving, and usually then they'll start the evaluation or send her to a specialist, and they'll send the man for a baseline semen analysis. So that has changed over the years as well.
Interesting. Yeah, I know Robert De Niro recently, I think, got his girlfriend or wife pregnant, and he's like 70.
Yeah, so sperm counts are worse as you get older. So your fertility rates go down, but most of us don't go down to zero, or a lot of us don't. And some women are super fertile. The way I sort of look at fertility when I'm talking to my patients is, let's say it takes 100 points to conceive. So where do those points come from? Obviously, no one has 100 points, but some come from the woman and some come from the man. So if you have a super, super fertile woman, then she may be able to conceive with sperm from a very subfertile man, but it's enough to get her to that 100. And vice versa, there's some men who are just super fertile, and so it's easy for their partners to get pregnant. I do worry about those children, because the children of older men do have, it's been proven, have more autism and schizophrenia. And you sort of see that if you look around at political figures and people who have older children. And if they're in the public eye, there's just more issues, often, not always, of course.
Interesting.
Yeah.
So I kind of wanted, as we wind down the podcast, I want to kind of take our audience through like maybe what a visit looks like with you. Do you have to be referred to you from a PCP? Can someone
Yeah.
just come see you? And then just what are the general steps to maybe reaching a diagnosis and a problem solving? Like we don't have to obviously take it through the whole gamut,
Yeah,
but
so if a man comes in with erection issues, then if we're pretty thorough. So they'll fill out a bunch of questionnaires, which will talk about their sleeping, their ejaculation, their general health, their urination, all of those issues, as well as a medical history. Then our nurse practitioner, who's amazing and has been here for 12 years, will synthesize everything and take a really good history. Stepping back before that, they will have seen our social worker, sex therapist, and given us a very clear and full sexual history. What is their sexuality? Have they been abused? What are the things that they're worried about? How is their current relationship? Is this a pattern that they've had? I mean, it goes on and on and on. And then the nurse practitioner, Nick, will present the patient to me. So I'll have both Paul Nelson and Nick Canoni's with both pieces, and we'll sort of synthesize them and come up with the evaluation. Most of the time, if they're having erection issues, we'll want to know how good are their nocturnal erections. So we'll send them home with a Ridgie scan. And then when they come back in, based on that, I'll do an ultrasound to look at the blood flow through the penis as they're getting an erection and how well they trap it. Simultaneously, we'll be looking at their hormones and the sensation of the penis. And after that second visit, we'll be able to really put everything together and come up with a game plan. And usually with treatment, you start at the least invasive and go up. I would say I'm a huge, huge proponent of the penile injections. Unfortunately, it takes a little bit of finesse to teach people how to do it. Basically, it sounds horrible and no one would ever do it, but it's actually amazing. Most of the porn stars use it. That's how they do what they do and why we feel badly about ourselves.
right.
Basically, they get these raging erections and they can actually last through the ejaculation. So a lot of times when they've been in 12 positions, which no real person does, they've ejaculated the first one and they just swap out the seeds. So the injections are much more powerful than the oral medications. They don't have any systemic side effects, and they really don't hurt when you use an auto injector, which is a device, except that they're done very poorly by most centers. There's some centers that only do that, and it's clearly all about the money. So a lot of men have even tried that and not had a good experience. So then we'd figure out what the options are, again, starting with the oral medications and moving up. So that's the evaluation for the erections. Actually, we do the same thing for men coming in with low testosterone, except if they're not having erection issues, obviously they don't need those two tests. And then for fertility, I usually try to have the wife come. I want her history as well. We want to make sure we've had semen analyses. They get an exam, sometimes an ultrasound, and we're looking for both, is there anything that we can do to make the semen analysis better if it's suboptimal, and also helping them sort of plug in where they should go next to maximize their chances of having a baby within a reasonable time.
That's awesome. I think just like clearing up, kind of taking down, the veil and maybe removing a little bit of friction. If one or more of our listeners is looking for, fertility specialist, they might not be in your part of the US, but at least they would know what to expect. And I think with men, if you kind of take away the stress of it, or at least give them something to expect and to kind of understand, it'll really help them receive treatment and be a little bit more open, and instead of like kind of shutting it out. So
yeah. I would say, even if they're coming from a distance, the one thing that I think would be worth traveling for, obviously, I think we do things fabulously, in general. But if a man has no sperm in the ejaculate before they do an open procedure that can damage the testis, they should, I think, come in, even if they fly in for that extended sperm search. So we do have people coming in actually from all over the world, but particularly all over this country doing that.
interesting. Yeah, that's we haven't heard about that. So, and I know you said you're one of the few or the only one that's doing it. So
Yeah,
you
I
guys
think
are
it'll become more common, but so far no one else has jumped on it.
right. Well, I mean, if that's the case, go check out Dr. Werner at Mays Men's Health. Dr. Werner, thank you so much for coming on the podcast and kind of giving us your 30 years of experience in about 40 minutes. It's really insightful.
Yeah, that's literally
And
all I know. No.
right. But
Thanks so much. I
for
appreciate
sure,
it.
you're always welcome. It was a great conversation. We'll talk soon.
Okay, take care. Bye.